Hello again, everyone. When studying the muscular activation of an overhead baseball pitch, Escamilla and Andrews pointed out six distinct phases and identified the activation of different muscles that contribute to the movement. The first phase is the windup. Muscle activation is generally very low due to the slow movements that occur within this phase. Shoulder forces and torques generated are also low. The greatest activity is from the upper traps, so base of your neck, the serratus anterior, the outside of your rib cage, and the anterior deltoids, the front of your shoulder. Escamilla and Andrews noted that very few, if any, shoulder injuries occur during this phase. The second phase is the stride. There is a dramatic increase in shoulder activity within this phase. Scapula upwardly rotate, elevate, and retract, and the shoulders abduct, externally rotate, and horizontally abduct due to concentric activity from several muscles, including the deltoids, so the entirety of the outside of your shoulder, the supraspinatus and infraspinatus, about the top side of your scapula, the serratus anterior and upper traps mentioned before. The third phase is arm cocking. Escamilla and Andrews state that kinetic energy that is generated from the larger lower extremities and trunk segments is transferred up the body to the smaller upper extremity segments. There is high to very high activity in the deltoids, pectoralis major, so your chest, supra and infraspinatus, your teres minor, which is just underneath that, your subscapularis, which sits underneath your scapula, and the rest of your posterior cuff muscles. And lastly, your latissimus dorsi has very high activation within this phase, your back muscle. Since the long head of the tricep brachii and both heads of the bicep brachii cross the shoulder, they generate moderate activity during this phase in order to provide additional stabilization to the shoulder. So bicep, tricep, long head. The fourth phase is arm acceleration. There is high to very high activity within the glenohumeral and scapula muscles and moderate activity in the deltoids. The subscapularis, pectoralis major, and latissimus dorsi have their highest activity during this phase. Escamilla and Andrews noted that there is little tricep EMG or activity during this phase. The fifth phase is arm deceleration. Large loads are generated at the shoulder to slow down the forward acceleration of the arm in this phase. High activity is generated by the infraspinatus, teres minor, and major. Teres minor, I already pointed out, teres major right next to it, posterior deltoids, and latissimus dorsi. According to Escamilla and Andrews, the bicep brachii generate their highest activity within this phase. The last phase, the follow-through, did not have significance to the reason for the study, so they didn't talk about muscle activation. Escamilla and Andrews claim that professional pitchers may exhibit better throwing efficiency, thus requiring less muscular activity compared with amateurs, due to the data that shows subscapularis activity being nearly twice as great in professional pitchers compared to amateur pitchers during the arm cocking phase. In contrast, muscle activity from the pectoralis major, supraspinatus, serratus anterior, and bicep brachii was about 50% greater in amateur pitchers compared with professional pitchers. They also claim that professional pitchers may better coordinate body segment movements to increase throwing efficiency because Gowan and colleagues demonstrated that rotator cuff and bicep brachii activity were 2 to 3 times higher in amateur pitchers compared to professional pitchers during the arm acceleration phase. This may help explain why professional pitchers experience less glenohumeral joint distraction and enhanced stability in the shoulder joint. This study, and ones like it, are extremely important in the field of both exercise and sport science. Knowledge of muscle activation patterns allow professionals to identify potential areas of strain or weakness. Kinesiology professionals can also develop training programs to optimize performance by understanding how muscles work during a pitch. Lastly, they can also help with designing rehabilitation programs that tailor to specific recovery processes from a potential throwing injury. Thank you.